Aging with a Smile Initiative, ASI, is a voluntary community-based organisation launched in January 2010 to promote and protect the health and rights of older persons in the Gambia. The vision of the organisation is to ensure that older people in the country enjoy good health, remain productive and are valued and cared for by society. The objectives of ASI are to improve access to basic healthcare services to disadvantaged elderly people in the Gambia, to promote the reintegration of elderly people into Gambian social life, to promote intergenerational dialogue, and to advocate for rights of the elderly in the Gambia and beyond.
We are here in Latrikunda, German. This is one of our monthly community-based screenings that we provide for the elderly, focusing on blood sugar, diabetes, of course, the blood pressure, and also eye testing. What we do is we mobilize medical volunteers from government facilities, from private sector, from the eye clinic at Secretary Regional Eye Care Center, come here and come very early in the morning, do this vital signs, the testing, and then we have medical doctors around who consult the patients free of charge, and then we also give out the medications to them at no cost. So as you can see, everybody is really enthusiastic about this. There's a lot of excitement. The elderly are appreciative of what we are doing. We are expecting to get about 100 older people here, but we are now over 200 and more, so I'm counting. So I think this is just showing the need to really focus and help the elderly to access basic health care in the country. We are also happy that the Minister of Health was here this morning, and he saw for himself how the challenges elder people face in accessing health care, and we think that's a strong message going to the Minister and also staff of the Ministry of Health to focus more attention to the health and welfare of older people in the Gambia.
My name is Dr. Siri Jow. I'm working at the Edinburgh Francis Small Teaching Hospital. The main aim of this act is to outreach to the people and help them with their health status, and at least to explain to them and give them some medical advice, and not only giving medications in the hospital, but also go to their communities and to know what their main health problems are.
Since its launch in January 2010, ASI has conducted up to 20 community-based health screenings and consultation programs, reaching over 6,000 older people in the Greater Banjul area and the West Coast region. The membership of ASI comprises of people from diverse backgrounds, including medical doctors, public health professionals, nurses, social workers, gender and human rights activists who work on a voluntary basis to deliver programs. Members and volunteers of the organization are motivated by the passion to make a positive impact in the lives of older persons.
I think it's very important to give back to your community as a young person, and when you are lucky to be one of the people that are educated and have the courage or mandate to give health service to the people, finding some of your free time to devote it back to the community is very important.
Hi, my name is Dr. Drame, and this is my colleague Priscilla. She's here for moral support, but I'll make her talk maybe. The reason I personally am volunteering in this screening event is because it's a way of giving back to the people that have issues with affording the healthcare system, especially when they're older. It comes to a point, most of them would have been retired, like family support will not be as much as when they're earning for themselves. So it's a chance that you can give them the care that they also deserve. Silla, what do you want to say?
You have said all.
No, say something.
She have said all. No, we're just trying to give back to the community. These are our grandparents. So as she said earlier, it's difficult sometimes at this old age to get the support. We're taking you to hospital every now and then. So sometimes when we come to the doorstep, like in the community, it's easier for them to reach us so that we can render the support that they need. Some things we can't do for them, but we can pick some things that we think they need to see a more specialized person on that end. Then what we do is we just make a small referral forms for them to go, so that they will see the best person, like the specialists in that area, because sometimes the environment is not conducive to do some examinations that they would need. So we can give them the basic support, like as we call it, maybe the primary healthcare delivery. We can render that and they will further follow up at the hospital.
My name is Bully Kamara. My profession is a medical doctor. I work with one of the institutions in this country. We've been part of this volunteering group for about 6 years now. And I remember going through my medical education in the teaching hospital. I've seen elderly people come to the hospital with conditions that could be prevented, when we organize things like this at community level. And that was one of the primary reasons why I wasted no time when I was approached by Mr. Joof and colleagues to join the team at the time to support the elderly at the community level. So I think as a Gambian, as a young Gambian, and like many other people, I think it's a responsibility on all of us to play our part in any way we can. And that's the motive that has driven me to take part in this volunteering. Yeah.
I volunteered to work with Aging with a Smile initiative personally because I wanted to help the elderly and get a reward from it by the Almighty Allah. Yeah. Nursing is all about caring, and I'm a student nurse. My passion is to become a nurse in future. That's why I kindly volunteer in this organization. Yeah.
So my name is Turay, and I'm a volunteer of Aging with a Smile initiative, which deals with helping the elderly. I have a huge passion for social work, especially with those groups that are in the minority. In the minority that is, they have been excluded, if you like. They're not in the main sphere of social work. I'm really inspired by how ASI helps the elderly, how it takes care of their health care and things like that. That is also another passion of mine. How can we help the elderly more? How can we make them feel happy in the latter years of their lives?
I am Amadou Rijalo. I am a health staff working for the Ministry of Health and Social Welfare under the Epidemiology and Disease Control Unit. We deal with diseases, and we know old age is associated with diseases. For that being the case, when I heard of this initiative, that is Aging with a Smile initiative, I was very, very interested, and I tried very much to make sure I become a member to contribute my quota. And equally, I am also growing gradually. So as I am growing, I'm going to be in the steps of those older people. And in as much as I want them to live a very dignified life and a happy life, although they're growing old, I want the same thing for myself. That's why I'm very interested in being a member of the Aging with a Smile initiative. Thank you.
I am Fatmata Kasama from Sezahir Regional Eye Care Center. I'm also a student at the University of the Gambia doing my bachelor's in nursing. This is one of the interns at Sezahir Regional Eye Care Center who just finished her program in diploma in ophthalmic nursing. So I mobilized her with 2 other interns to come and participate, contribute in their community. It's not just about paid jobs. You have to ask yourself, what role do I play in my community? You have to give back to your community. So I told her it is very important, you need to contribute in your community. So, and you get to learn so many things, meet people from different walks of life. Your network becomes broad. So if you come and participate, you open so many opportunities for yourself. So it was yesterday that I told her, she was like, I'm ever ready to come and participate. So today she came and she did wonders. She was able to take vision for so many people and did ocular examinations.
Hi everyone, I am Lintin Baya.
a registered nurse working at Shakeside Regional Eye Care Center and doing my internship in ophthalmic nursing, which I recently just finished. Since Fatmata told me about it, I saw it as an opportunity to come and give back to the people I've ever wanted to be part of. It's true, not all patients are able to go to the hospital. So when we have programs like this where they can easily come out and then give their complaints, and then we see what we can do for them, at this point we do what we can do for them, and then whoever needs referral, we send them to the hospital to come for their management.
And so I see, that life is special, and hope that
It's been a great day for Bala Musa Joof and for all the volunteers who took part in today's initiative, and of course especially for the elderly in the community, who are very grateful to Bala and to Aging with a Smile initiative.
The nicest thing is we've been here with our parents who are aged, but now they've come in large numbers to complain their health problems. And they've been treated well. This is the first time of doing it, but the turnover so far so good is good. So I think these are positive steps towards this organization. It's very encouraging.
kontaan naa trop si bés bi daal di sant yàlla la ñëw fii mais ñu garab mag ñi xale yëpp suma yaay léegi la ñibbi mais nañ ko garab benn ñibbi ñu leen a ñaanal daal seen li yal na jëm kanam leen ñaanal wér ak ñoom Ibou Ndiaye yëpp ñu di leen ñaanal jàmm ak teraanga salaam daal ñu leen a ñaanal parce que lii moom ñëw ñu may la garab te fayloo dara loolu sant yàlla la du dégg ñu leen a ñaanal jàmm yal na yàlla yàggal seen taxawaay barke alquran. Thank you very much.
Life is special, life is special.